clinical name for dry mouth. They call it xerostomia. But honestly, that word does not even come close to describing what it actually feels like. You wake up in the morning and your tongue feels stuck to the roof of your mouth. Your lips feel dry. The corners of your mouth feel cracked. Your throat feels rough, like it has been coated with dust. And before you even check your phone, before you even get out of bed, you reach for water. Then immediately, your mind gives you an easy explanation. Maybe I slept with my mouth open. Maybe I did not drink enough water yesterday. Maybe the room was too dry. Maybe it is just age. But for people over 60, waking up with a dry mouth again and again is not something you should casually ignore. Because many times this is not just about sleep, it is not just about the weather, and it is not always just about drinking less water. Morning dry mouth can be a signal that something deeper is happening inside the body. And the important thing is this: once you understand the real cause, dry mouth is often manageable. You do not have to accept it as a normal part of aging. So in this video, I want to walk you through 5 common reasons why people over 60 wake up with a dry mouth, what each one means, and what simple steps you can take starting this week. And stay with me until the end, because I will also explain when dry mouth can become dangerous and when you should not try to manage it at home. The first major cause is medication. This is the one that surprises people the most. Many people over 60 are taking one or more regular medicines. Maybe something for blood pressure, maybe allergy medicine, maybe a sleep aid, maybe medication for mood, bladder control, pain, or muscle relaxation. These medicines may feel normal because you have been taking them for years. But here is what many people do not realize. Hundreds of commonly used medications can cause dry mouth as a side effect. Some blood pressure medicines can do it, some antihistamines can do it, some antidepressants can do it, some bladder medicines can do it, some pain medicines, muscle relaxants, and sleep medicines can do it too. The reason is simple. Your salivary glands need signals from your nervous system to produce saliva. Certain medications reduce or interfere with those signals, so your mouth produces less saliva than it should. During the day, you may not notice it as much because you are drinking water, eating, talking, and swallowing. But at night, when you are asleep for 6, 7, or 8 hours, the dryness becomes much more obvious. And if you are taking more than one medicine that can cause dry mouth, the effect can become stronger. That is why a medication review is so important. Do not stop any medicine on your own. But do this. Write down every medicine you take. Include prescription medicines, over-the-counter pills, supplements, allergy tablets, sleep aids, and pain relievers. Then take that list to your doctor or pharmacist and ask one clear question. Could any of these be causing my dry mouth at night? Sometimes the solution is not complicated. Your doctor may adjust the timing. They may change the dose. They may suggest an alternative. But that conversation only happens if you bring it up. The second cause is sleep apnea. Sleep apnea means your breathing repeatedly stops or becomes blocked while you sleep. When this happens, your body may switch to mouth breathing. And when you breathe through your mouth for hours, moisture disappears quickly. That is why many people with sleep apnea wake up with a very dry mouth. But dry mouth is only one part of the problem. Sleep apnea can also affect your heart, blood pressure, energy, brain function, and overall health. This is why it should not be ignored. Ask yourself these questions. Do you snore loudly? Has anyone ever told you that you stop breathing during sleep? Do you wake up gasping or choking? Do you wake up with morning headaches? Do you sleep for 8 or 9 hours but still feel exhausted? If 2 or more of these sound familiar, dry mouth may be a warning sign of sleep apnea. In that case, speak with your doctor about a sleep study. Many sleep studies can now be done at home. You wear a small device overnight, and it records your breathing, oxygen levels, and sleep patterns. If sleep apnea is found, treatment can make a major difference. It can improve your sleep. It can reduce morning dry mouth. And more importantly, it can reduce serious health risks. The third cause is blood sugar. High blood sugar can quietly dehydrate the body. When glucose levels stay too high, your kidneys try to remove the extra sugar through urine. To do that, the body uses more water, so you urinate more, you lose more fluid, and your tissues, including your salivary glands, may not have enough hydration to work properly. This can lead to dry mouth, especially in the morning. A common pattern is this. You wake up with a dry mouth, you feel very thirsty, and you also wake up at night to urinate. If these 3 things are happening together, do not just blame your pillow, your fan, or your sleeping position. It may be time to check your blood sugar. Type 2 diabetes can develop slowly. Many people do not notice clear symptoms in the beginning. They may feel a little more tired. They may feel more thirsty. They may wake up at night more often. They may have dry mouth every morning. But because these symptoms are mild, they often get blamed on aging. That delay can be costly. So ask your doctor for an HbA1c test. This test shows your average blood sugar over the past 2 to 3 months. It does not usually require fasting, and it gives you useful information about what may be happening inside your body. Remember, information is not the enemy, not knowing is the bigger risk. The fourth cause is dehydration, but this is not as simple as saying drink more water. As we get older, the thirst signal often becomes weaker. That means you can be dehydrated and still not feel very thirsty. A younger person may feel thirsty quickly when the body needs water, but after 60 or 65, the body may not send that signal clearly, so you may go through the day thinking you are fine. Maybe you have coffee in the morning, maybe one glass of water at lunch, maybe some tea in the evening, but overall, your fluid intake may be too low. Then you sleep all night without drinking anything. By morning, your mouth feels dry, sticky, and uncomfortable. The solution is to create a routine. Do not depend only on thirst. Start your morning with water before coffee. Keep water nearby during the day. Drink steadily instead of trying to drink a lot at night. 6 to 8 glasses across the day is a reasonable goal for many people, unless your doctor has told you to restrict fluids because of heart, kidney, or other medical conditions. Also, pay attention to what may be drying you out. Too much coffee can contribute. Alcohol can contribute. Caffeinated sodas can contribute. An alcohol-based mouthwash can make dry mouth worse. Many people use strong mouthwash at night thinking it will improve their breath, but if it contains alcohol, it may dry the mouth even more. A better option for many people is a xylitol-based mouth rinse or dry mouth product before bed. It can help support moisture and may feel much gentler than alcohol-based rinses. The fifth cause is Sjogren's syndrome. This is an autoimmune condition. It means the immune system mistakenly attacks the body's own moisture-producing glands. The two most common areas affected are the glands that produce saliva and the glands that produce tears. So people with Sjogren's often experience dry mouth and dry eyes together. This condition is more common in women, especially around middle age and older age, but men can have it too. The problem is that it is often missed. Why? Because the symptoms appear slowly. People adjust. They carry water everywhere. They use eye drops. They avoid dry foods. They wake up with dry mouth every morning and assume it is just aging. But persistent dry mouth with dry eyes is not something to ignore. Ask yourself, has your dry mouth lasted for months? Do you also have dry, irritated, or gritty eyes? Do you struggle to swallow dry foods like crackers or bread without water? Do you have a dry throat or dry nose often? Are you getting more dental problems than before? If yes, speak with your doctor. Ask whether Sjogren's syndrome should be ruled out. There are blood tests that can help, including anti-SSA and anti-SSB antibodies. Your doctor may also refer you to a specialist. Getting the right diagnosis matters because treatment and management can protect your teeth, eyes, mouth, and quality of life. Now here is the part most people miss. Dry mouth is often not caused by only one thing. It may be medications plus dehydration, or dehydration plus mouth breathing, or sleep apnea plus blood sugar problems, or medications plus sleep apnea plus low fluid intake. When these causes combine, the dryness can become much worse. And this matters because saliva is not just moisture. Saliva protects you. It helps control bacteria. It protects your teeth from decay. It supports your gums. It helps balance acid in the mouth. It helps with swallowing and speaking. When saliva stays low for months or years, dental problems can increase. Cavities can happen faster. Gum disease can worsen. Bad breath can become more persistent. Mouth infections can become more common. And chronic inflammation in the mouth can affect more than just your teeth. So please do not treat ongoing morning dry mouth as a small inconvenience. It is a signal, and signals deserve attention. Now let me give you a simple 5-step plan you can start this week. Step 1. Do a medication audit. Write down every product you take regularly. Prescription medicines, over-the-counter pills, supplements, allergy tablets, sleep aids, pain relievers. Then ask your doctor or pharmacist if any of them can reduce saliva or worsen dry mouth. Step 2. Check your sleep honestly. If you snore loudly, wake up gasping, have morning headaches, or feel tired after a full night of sleep, ask about a sleep study. Step 3. Check your blood sugar. Ask for an HbA1c test, especially if dry mouth comes with strong thirst or nighttime urination. Step 4. Build a hydration routine. Drink water earlier in the day. Do not wait until you feel thirsty. Reduce alcohol-based mouthwash. Consider a xylitol-based rinse before bed. Step 5. Look for signs of something autoimmune. If dry mouth has lasted for months and comes with dry eyes or trouble swallowing dry foods, ask your doctor about Sjogren's testing, including anti-SSA and anti-SSB antibodies. And one final warning. If your dry mouth comes with white patches inside the mouth, significant pain, A burning sensation, bleeding, mouth sores that do not heal, or unexplained weight loss, do not manage it at home. Book a medical appointment. Those symptoms need proper evaluation. So here is what I want you to do today. Open your medicine cabinet. Look at what you take regularly. Pick just 2 products and check whether dry mouth is listed as a side effect. That one small step could give you the exact clue you need. Because your body is always communicating. Some signals are loud, some are quiet. Morning dry mouth is one of the quiet ones. But quiet does not mean harmless. And now, you know what it might be trying to tell you. Take it seriously, ask the right questions, and give your body the attention it has been asking for.